Hello and welcome to Epi-Center. My name is Camilla Foy, and today I'm going to be taking you through the basics of epilepsy, the symptoms, the causes, the statistics, etc. Epilepsy, as mentioned in my first episode, is a disorder, not to be confused with a disease, in which surges of electrical activity in the brain cause unprovoked seizures. To understand what seizures are, this is when bursts of electrical activity in the brain changes or disrupts the way messages are sent between brain cells. So to give you an idea of what this is, in a healthy brain, neurons communicate to each other by firing action potentials. Different groups of neurons fire these action potentials at different times, leading to normal brain activity. During a seizure, instead of firing action potentials at controlled rates, they all fire at the same time, leading to large spikes in brain activity. This can cause involuntary changes in body movement or function, sensation, behavior, or awareness. However, it is important to note that not everyone who has a seizure has epilepsy. Sometimes seizures are caused by illnesses or trauma, substance abuse, or even withdrawals from substances. These are classified as provoked seizures. People with epilepsy have a higher risk for recurring seizures. Because epilepsy is a spectrum disorder, there are different types of epilepsy and seizures. This means that no case is the same. As while some people might have violent seizures, others might have unnoticeable seizures. For example, people with absent seizures may blank out or stare off into space for a few seconds. And to someone who doesn't know what these are, they're probably going to think that, oh, they're just staring off into space, they're daydreaming, nothing wrong is going on with them, but in reality, they could have epilepsy. Different things can vary in epilepsy, such as the type, the frequency, and severity of seizures, the areas of the brain affected, the cause of epilepsy, how a person responds to treatment, and underlying brain abnormalities present. During the beginning of a seizure, some people might feel it before it happens. They might experience feelings, sensations, or changes in behavior days or hours before a seizure. Generally, this isn't a part of the seizure, but is a warning sign. The first part of a seizure is the aura. This is an indescribable feeling to those affected. Many people don't even have an aura warning. This can also occur alone and can be called a focal onset aware seizure. Common symptoms of a seizure are déjà vu or even jamais vu, which is a feeling that something is new or unfamiliar, even though it isn't. One might smell odd things, hear strange sounds, have visual loss or blurring, strange feelings, experience fear or panic, maybe even have pleasant feelings, or racing thoughts. One experiencing a seizure can feel dizzy or lightheaded, have a headache, nausea, or other stomach problems, or feel numbness or tingling in parts of the body. The middle of a seizure, often called the ictal phase, is the period of time from the first symptoms to the end of the seizure activity. There are cases in which the visible symptoms last longer than the activity on an EEG, meaning the physical activity can last longer than the brain activity. It is important to note that some of the visual symptoms can be the after effect of a seizure or not related to seizure activity at all. This period of the seizure has the most symptoms ranging from physical and mental changes. One could experience a loss of awareness, feel confused or spacey, or have memory lapses. There are also times where a patient could feel distracted or be daydreaming, or completely lose consciousness altogether. Some might be unable to hear, and sounds might sound strange or different. Unusual smells may be present, along with unusual tastes. Loss of vision or blurry vision, flashing lights, and visual hallucinations are even more related symptoms. Numbness, tingling, or electric shock, feeling of fear, panic, or impending doom, even pleasant feelings are present during a seizure. Some people with epilepsy have described out-of-body sensations, which just means they don't feel like they are inside their own body. Some might feel like they're watching themselves from a third-person point of view, or they just might feel detached. The physical symptoms are the ones that we are most familiar with. Difficulty talking, unable to swallow, repeated blinking or abnormal eye movement, lack of movement, tremors, twitching, jerking movements, rigid or tense muscles, repeated non-purposeful movements or purposeful movements, convulsions, losing control of urine or stool unexpectedly, sweating, becoming pale or flushed, dilation of pupils, biting of the tongue, difficulty breathing, and heart racing are all symptoms. By the end of a seizure, this is the post-ictal phase, known as the recovery period. This can range from immediate recovery to minutes or hours before one can feel their usual self. A person with epilepsy may be slow to respond at this time and feel sleepy, confused, have memory loss, have difficulty writing or talking, feeling dizzy, depressed, upset, scared, anxious, frustrated, embarrassed, or ashamed. Be aware of any injuries as well, as people with convulsive seizures can hurt themselves easily. They might also have a headache or other pain, nausea or an upset stomach, and general weakness. The overall risk of dying in people with epilepsy is 1.6 to 3 times higher than the general population. If seizures can't be stopped, or repeated seizures happen one after another, permanent injury or death can occur. If a seizure lasts 5 minutes or longer, it is considered a medical emergency and you should call 911. Now, something that people probably wonder is, what are the causes of epilepsy? And this is one of the most frustrating things because 50% of people don't know why they have epilepsy. There are a few known reasons, but it's not the same in each case. Epilepsy can be developed at any age in any person. However, it is more common in young children and older people. 1 in 26 people have epilepsy, affecting more than 65 million people worldwide. Epilepsy is more common in men than women, but only by a small amount. Usually, new cases of epilepsy are most common among young children, the new case range being from 0 to 10 years old. Usually by then, the rates stabilize. After the age of 55, the new cases increase as strokes, brain tumors, or Alzheimer's all become more common and can cause epilepsy. Brain injuries can also cause epilepsy. This can be anything from a failed surgery to hitting your head too hard to an infection. Another cause can be genetics. The seizures I mentioned before, absent seizures, are considered to be genetic. Developmental disorders are also thought to be a cause of epilepsy, as well as prenatal injuries. Epilepsy is more common in people with a Hispanic background, although I'm not sure if that encompasses all Latins because there are countries in South America, such as Brazil, where my mom is from, that are not considered Hispanic. Active epilepsy, which are seizures that are not completely controlled, are more common in white people, and the number of people who developed epilepsy over a lifetime is more common in Black people. 1.5% of Asians live with epilepsy. Something important to note is that mental health in people with epilepsy is considerably worse than the general population. People with epilepsy are 5 times more likely to develop mental and behavioral problems. 30 to 50% of patients develop mental health problems as compared to 8.5% of the general population. People with epilepsy can suffer from anxiety, depression, etc. Unfortunately, because children with epilepsy are bullied because of their condition, it doesn't make the situation any better for them. All they want to do is have a normal life, but it isn't always easy. Because of bullying, it can make mental health even worse for them. To conclude today's episode, I will outline the key topics discussed. Epilepsy is so vast, and everyone has different situations with epilepsy. Whether they have violent seizures to barely recognizable ones, no one person with epilepsy is the exact same. Even with all the complex information doctors have dug up on this disorder, there's still so much unknown about it. There are people out there who don't know why they have epilepsy and can't do anything about it. Then there are those who will have one seizure, know exactly why they'll have it, and they take medications and never have a seizure again. Even if we don't have all the answers now, it is extremely important to raise awareness to epilepsy. Thank you for listening to today's episode and stay tuned for more. In the next episode, I will be discussing the different types of seizures related to epilepsy. Have an amazing day and thank you for listening to Epi-Center.